Hello, everybody. Welcome back on another Sunday with a fresh guest on the channel. And today we are here with Dr. Tanasvi Mattoo. She's a physiotherapist from India. And to know more about her details, she'll actually be sharing the bio herself. And next on the screen is Dr. Tanasvi Mattoo. Ma'am, over to you. Please tell us a little things about
Yes.
yourself, and then we'll start.
Hello, Dr. Aarti. Hello, Dr. Aarti. I'm Dr. Tanasvi Mattoo, a physiotherapist by profession, and thank you for welcoming me on this podcast. I'm very glad that I am going to share my journey regarding this therapy and the few queries that you are having about women empowerment and women health. So we are going to discuss about that, and very happy to share my views on that.
You're most welcome. We have a few questions from you. So I'll start with the first question and what we want to know. So, Doctor, you have been a leading physiotherapist and healthcare influencer. And then you
Yes.
actually have been working since how many years? 10 years? Last 10 years? Or more than that?
Yes. Last 10 years, I'm working on this field. Yes.
Okay. So, what inspired you to focus on the specific areas of healthcare and what did you actually find as a pressing issue in the health for the females nowadays?
The thing that inspired me to join this field is that uh, basically the women health that inspired me a lot, because being I see in this 10 years that women are facing a lot of problems, and regarding their, they are not taking proper health, they're not taking care of their health properly. Basically the physical therapy is the profession where we can give a proper treatment to the patient without any medicine, first of all. And that inspired me the most, because the medicine are giving them a side effect that the people used to having regard in these days. So physical therapy is the profession without any side effect, without any like that basically give the mobility to the joints especially. And the women's in the field of women's are facing a few most of the problems, like basic, the first problem is they're facing is arthritis problem. In the most of the 70% of women, the first thing they are facing about the arthritis. And in that case, they are not taking proper care, because there's regarding that the medicine that they used to take earlier, that get side effect on their body, and that they used to leave the like the basically the disease they are suffering from. And लाइक ना वो छोड़ देते थे उस चीज को कि वो हमें इफेक्ट कर रहा है. तक एक फिजिकल थेरेपी एक ऐसा प्रोफेशन आ गया है जिसमें ना नाइदर दे आर हैविंग एनी साइड इफेक्ट ऑन देयर बॉडी, है ना. तो बेसिकली तो एक थेरेपी का मीनिंग क्या है, द द ट्रीटमेंट दैट यू आर गेटिंग इस, और वो एक साइड इफेक्ट के बिना. तो एक सबसे बड़ा फर्स्ट प्लस पॉइंट एक मेरा ये था एक थेरेपी फील्ड को ज्वाइन करना, है ना. एंड बिकॉज इट इज अ प्रोफेशन दैट आई थिंक इट्स बीन 15 years दैट एक वो बहुत हमारे इंडिया में बहुत ये चीज आ चुकी है, पीपल फोकसिंग ऑन द थेरेपीज एरियाज, है
Right,
ना.
right, right.
एंड है ना, आप ये समझते हैं कि थेरेपी को एक ऐसा प्रोफेशन लाइक माना जा रहा है कि आई थिंक 80% आर फोकसिंग ऑन द थेरेपीज पीपल्स, बिकॉज देयर इज नो साइड इफेक्ट, उसका कोई साइड इफेक्ट नहीं है. एंड फर्स्ट पॉइंट मेरा ये था कि एक थेरेपी को मुझे ज्वाइन करना है. सबसे पहला तो एक वो मेरा पॉइंट था कि हाँ, इसका कोई साइड इफेक्ट नहीं है, ठीक है. एक मेन मेरा मोटिव जो ये था, बिकॉज आई एम बिलोंग टू ए डॉक्टर फैमिली, एंड दे मोस्ट ऑफ द डॉक्टर्स आर एमबीबीएस एंड एमडी, एंड वन ऑफ मैं एक थेरेपिस्ट एक अपनी फैमिली में हूँ. तो एक मेरा मोटिव ये था कि हाँ, एक ऐसा प्रोफेशन चूज किया जाए that lead to a better empowerment in the women health care also and other people also.
Right, right. That's a very good, choice of a career because therapies, जितनी मैंने भी देखी है, it's very, though I was talking about last 10 years, we haven't seen much of the therapist. But अब आगे आगे
Yeah.
we are talking about more therapies because there's no side effect. That is very true.
Yes.
So in that
साला
case,
हाँ, एक प्लस पॉइंट.
हाँ, सबसे important plus point वही है because medicines always is not good for health for the long period of time. So therapy
Right.
अगर आप कोई लेता है is very good. And then too, we don't see much
Right.
therapist as a female. So as a female, if you're doing that,
Right.
is actually it's a turning stone for the science, for the medical science. Okay,
Right.
moving to the
Right.
next question.
Right.
So your work basically is into sports therapy, and you have undoubtedly has have a very
Sports
significant impact on the uh, women's. So how do you believe physical therapy can actually play a very important role in empowering the females in terms of their health, and how can that keep them more active, especially in terms of the motherhood and the aging ladies or the chronic diseases? So how can that actually
right.
be served?
like in motherhood, like basically I'm also a mother. तो जो बेसिक मैंने भी जो चीजें फेस करी हैं इन आफ्टर बीइंग अ मदरहुड इज बेसिकली दैट मदर, तो होता है ना कि मदर अपना ध्यान बहुत कम रखती है आफ्टर हैविंग ए चाइल्ड, है ना, because after being after becoming a mother, the women basically feel the problems like their backache first. The first issue, the basic issue they used to face is backache, है ना. In this field we used to after pregnancy, when a mother deliver a child, after a few days we used to guide them a few exercises like Kegel exercises. We used to guide them that is used to give the strengthening to the muscles basically. And after delivering the child, the mother muscles quite get weak.
Right.
After that, um, right, है ना, you understand? And the mother who doesn't take care of them, वो future में क्या suffer करती हैं? Basically the back pain. First of all, they used to suffer the back pain. The first side effect of the pregnancy, back pain. If the mother doesn't take care of that, it will get aggravated in the future process.
Very true.
तो
Right.
जो फर्स्ट हम, हाँ, जो फर्स्ट सबसे पहले जो हम गाइड करते हैं एक मदर को स्पेशली, दैट प्लीज टेक केयर ऑफ योरसेल्फ, है ना. तो द फर्स्ट वी यूज्ड टू गाइड देम टू स्ट्रेंथन देयर बैक एक्सरसाइजेस. वी यूज्ड टू गाइड देम अबाउट द बैक एक्सरसाइजेस फर्स्ट ऑफ ऑल, बिकॉज द फर्स्ट पार्ट हमारे बॉडी का फिट करता है इज द बैक, and because they have to take care of the child also. But nowadays the women are quite alert about this. I think in the earlier ages women are not alert about this, है ना. तो I think the today's women are quite alert about their health.
Yeah,
So being a
they're very
therapist is a very
self-conscious. They're very
very
self-conscious
self,
too.
yeah, very selfish. So I've seen a lot of changes in women right now. I think the most of the patients of mine are women. They are taking proper care of themselves. Yeah.
So
So I think
apart from
today women's are
apart from बैक और कौन सा प्रॉब्लम हो सकता है और ध्यान रखना चाहिए किसी को?
like arthritis. You can see. Okay,
Arthritis,
they are problems
arthritis,
like you
is
can
not
feel.
age limited, right? Arthritis can
So
happen
in the earlier,
at
it's
any age.
not, it's arthur. You can see in right now the because vitamin D is the most common problem that
Lacking.
I think children are also facing. I have seen few of the patient in the earlier stages they are suffering from arthritis problems. Few of my patients are of earlier age and they're having severe arthritis problems because there's a lack of vitamin D. I think all the women right now they are facing the vitamin D issues nowadays. I think in the earlier child also we can see because they are not sitting in the sunlight areas
Yeah,
and they are
they are no going to play outside.
yeah,
There's no everything is
right,
indoor
right, right.
actually. Okay.
Kids of the 10
Very
year age are coming to me, ma'am, and they are suffering from vitamin D.
very interesting.
So the
Okay, so
most common harm.
the
The
third
thing, the
question
first
that
common
I
harm.
would prefer to ask you is that as an advocate of female health, you have got a lot of awards. You have been recognized with different awards. For example, the Her Story Times Inspiration Award, and then
Right.
we are still expecting some awards to come your way, maybe the next week.
Thank you so
So
much.
what are the challenges that you actually faced to reach to this point ultimately, and then how could you overcome them?
The challenges which I face, I think, mm, like challenges तो मैंने नहीं face करे हैं basically. That's a plus point for me
Because you are from the medical
because
background,
I
your
got
family
a
is there,
lot,
right?
yeah, I have the medical, there are a lot of support to me in my families. So basically, my journey is quite smooth in that case. But the challenges मेरे पास basically जो आए हैं regarding our patients, because a few the patients used to come from that area to like a villages area. It's very difficult for me to explain okay, what is the treatment I'm giving to you. So like therapy is the process. It will take some quite time. Like
Right, right.
it's not like a painkiller. You just take one painkiller and the pain is relieved. So the most challenges मुझे आए regarding my field is the how to deal the patients, especially the old ages,
To make them understand,
because this treatment used to take
it takes
some time.
time. Yeah.
Yeah. The first challenge I used to face is that in my profession basically, and the second challenge I used to face that like to make the women understand that how you should take care of your health basically, क्योंकि women क्या होता है वो अपने घर में इतनी involved हो जाती हैं कि वो अपना health को भूल ही जाती हैं basically, है ना. To
Right.
make them understand, especially the old age people I'm talking about, because the youngsters are quite active. जो young people हैं they are quite active about their health. Basically the villages area people that used to come to me to make them understand the use of physiotherapy, their effects on them. तो
राइट।
ये
सो
दो चैलेंज मैंने जरूर फेस करे हैं।
पहले हम सुनते थे कि जो प्रॉब्लम्स हैं दैट बेसिकली कम आफ्टर 40 इयर्स ऑफ एज, बट नाउ डेज इट्स
या
वेरी एट अ वेरी यंग एज पीपल
it's
आर हैविंग
very
दिस काइंड
common
ऑफ इश्यूज।
earlier already. Yeah, I've seen the school going student having backache. They're coming to me regarding backache because their posture is quite different. Posture to pura, I think they have totally destroying their postures because of the mobiles, especially I can say. And जो basic मैंने बच्चों में देखा है, their postural problems they are facing. And in old age women that I think the जो आजकल की जो हमारी modified life है, that has make a side effect on the human body
राइट
because we
राइट।
are having everything machinery has been done. एक वो साइड इफेक्ट सबसे ज्यादा मैंने देखा है जो हमारी बॉडीज में स्पेशली आ रहा है लाइक, ठीक है। एंड ये दो चीजें मैंने कॉमन देखी, एक तो हमारा डेली जो लाइफ स्टाइल हमारा चेंज हो रहा है डे बाई डे, आई थिंक, है ना। तो यंगस्टर्स तो आई थिंक दे आर नॉट अवेयर अबाउट देयर हेल्थ, दे आर ईटिंग, दे आर वो तो अपने उसमें ही लाइक जोन में है अभी, पर आई नो कि दे आर इन कमिंग फ्यू टाइम दे आर गोइंग टू फेस दिस प्रॉब्लम्स।
या सो वी
या
नीड टू हैव मोर अवेयरनेस। सो आप अवेयरनेस के लिए आप कुछ आप एजुकेशनल कुछ अवेयरनेस के लिए कुछ करते हैं आप, जैसे कि थ्रू किसी को इन्फॉर्मेशन मिले? हालांकि सोशल मीडिया पे काफ़ी इन्फॉर्मेशन है आजकल, बट स्टिल।
right. Like we used to take few workshops regarding this. I used to take some few workshops regarding this, especially after the जो मेरे मोस्टली पेशेंट्स हैं वो above 40 हैं, जो मेरी अवेयरनेस होती है above 40, ठीक है। दे आर फ्यू लाइक आई द मेन लाइक एक तो वुमेन्स आज जो फेस कर रही है दे आर गेनिंग द वेटिंग इशू आर एक बहुत बड़ा कॉमन प्रॉब्लम आ रहा है वुमेन्स के अंदर बिकॉज ऑफ डाइटरी हैबिट्स, है ना। और तो एक जो मेरा मेन मोटिव रहता है वुमेन्स के लिए दैट यू शुड बी डू डेली हाफ एन आवर एक्सरसाइज जस्ट टू स्ट्रेंथन योर मसल्स बेसिकली, क्योंकि इफ योर मसल विल गेट स्ट्रेंथन देन एवरीथिंग इज सॉल्व राइट नाउ, ठीक है। तो मेरा मेन वर्कशॉप्स बेसिकली यही रहते हैं, लाइक आई यूज्ड टू फीड बेसिक एक्सरसाइजेस रिगार्डिंग नीज, रिगार्डिंग बैक। आई यूज्ड टू टेल टू ऑल द वुमेन्स प्लीज डू दिस बेसिक एक्सरसाइज डेली। तो लाइक मेरे फ्यू वर्कशॉप्स बेसिकली इसी चीज पे रहते हैं। आई यूज टू फोकस मोस्ट ऑफ द वुमेन्स की वो फ्यू हमारे की हम अपने एरियाज में भी मैं थोड़ा वर्कशॉप से अटेंड करवाती हूँ कि अदर दे यूज टू कर कि बेसिक जो चीजें हैं, मैं ये नहीं कह रही कि बहुत आगे की फ्यूचर के लिए सोचो, बेसिक चीजें एटलीस्ट यू शुड डू डेली फॉर योर बेटर फॉर
Okay.
बेटर हेल्थ।
That's very true and that's very enlightening actually. And the second, the next question that I would want to ask you is, जैसे आपने बताया कि आपकी काफ़ी सारे आपके जो ऑडियंस हैं, जो आपके क्लाइंट्स हैं, वो रूरल एरिया से रहते हैं, तो समझाने में मुश्किल होता है। प्लस एज
राइट,
एज पैरामीटर भी रहता है। सो इन टर्म्स ऑफ द फिजिकल हेल्थ,
हाँ,
so what advice would you actually give them to to not be hesitant and to seek the undergo the treatment that they should actually, or maybe the earliest stage treatments that they should come to you? So उस केस में आप क्या करते हो? आप
राइट।
what advice do you give them?
इसी द एडवाइस जो मैं इनको देखे देती हूँ, एक्चुअली एक तो हमारे वुमेन्स में क्या होता है ना, दे यूज टू आइदर कम विद देयर फैमिली इन द हॉस्पिटल। तो आधों को ये रहता है कि मैम ट्रीटमेंट कितना रहेगा, 10 दिन में, ये 5 दिन में ठीक हो जाएगा, पर थेरेपीज में ऐसा नहीं है बिकॉज इफ यू कमिंग ऑन द क्रॉनिक स्टेज हाउ कैन बी क्योर अर्लियर ना। तो सबसे पहले मेरा गाइडलाइंस रहता है दैट वुमेन्स को मैं समझाती हूँ प्लीज टेक केयर ऑफ योर सेल्फ, नॉट लिसन टू एवरीवन। बिकॉज बेसिकली क्या होता है, हस्बैंड्स बोलते हैं मैम बस 10 दिन में ट्रीटमेंट करो और छोड़ दो, तो
And
ऐसा
that's not
नहीं होता
possible.
है। तो उनको गाइड करना, है ना, दैट्स नॉट पॉसिबल बिकॉज इट कैन कोई क्रॉनिक स्टेज एक्टिव स्टेज में आता है कैन हील बाय विद इन 1 वीक। पर जैसे कि जब आफ्टर व्हेन दे यूज्ड टू गेट द रिलीफ, तो वुमेन वो खुद ही अंडरस्टैंड करती है इस चीज को, हाँ इट्स अ ट्रीटमेंट विदाउट एनी साइड इफेक्ट एंड ऑल। एंड तो फ्यू अब तो खैर वुमेन समझने लगी हैं इस चीज को बिकॉज एक फिजिकल तो फिजियोथेरेपी एक ऐसा प्रोफेशन आ चुका है ना कि आप किसी से भी सुन सकते हो। लाइक इफ आई यूज्ड टू ट्रीट सम वन पर्सन ही यूज्ड टू टेल कि नहीं ये अच्छा ट्रीटमेंट है। तो एक थोड़ा आजकल के सोशल लाइफ में हो गया कि लोग एक दूसरे से सुन के भी ये चीज तरीके नहीं है अच्छा है तो वी हैव टू गो देयर। तो थोड़ा तो इम्प्रोवाइजमेंट हो चुका है इस चीज में।
कई बार फीमेल्स कंफर्टेबल नहीं हो पाती हैं, अगर मेल फिजियोथेरेपिस्ट हैं, तो कई बार जेंडर की वजह से कंफर्टेबल नहीं हो
या
पाती हैं, तो आपका एक
या
बेटर रोल वहाँ पे प्ले होता है कि आप एटलीस्ट वी आर कंफर्टेबल विद अ
हाँ
फीमेल,
या दैट्स द पॉइंट राइट।
तो इनफैक्ट
But I think up to
व्हाट आई सीन।
I've seen lots of changes in women right now.
यस
जो
यस।
इस समय की जो लेडीज हैं, I've seen a lot of changes in them.
Right. So here
But
also,
being a
I
doctor,
just came across a friend. My friend was actually, because we also in the education domain, we have to keep on sitting for like almost more than 12 hours. So even she was
yeah,
having that issue, and then ultimately it took about almost like 3 4 months to be okay because she was having pain in the she was having croxodynia. So croxodynia basically is when you sit
Okay,
for a long
okay,
period of
okay.
time, and then after 3 months of
Right,
the same, almost like 6 7 times a month, she used to go for physiotherapy, and now she's better without any medicines. So I guess
right, right, right.
physiotherapy, it's time taking, but it is the most curable stuff that you can
The
actually
first
use.
advice I should give to everyone when the pain used to get started in the earliest stage, please take care of your yourself. First
Right.
advice I used to give to every woman. क्योंकि women क्या करते हैं वो delay कर देती है उस चीज को. They used
Mm-hmm.
to delay.
So you
हो
should not
जाएगा,
ignore.
हो जाएगा. But हाँ,
Right.
I think आजकल के टाइम में we had to if either sing कुछ भी छोटा सा भी पेन हो तो we had to recheck it out because
That's
there are
very
lots of
important.
diseases are coming in the body. है ना? तो it's first of all we have to take early stage में ही we have to step in for our treatment. एक साइड इफेक्ट वुमेन्स यही करती हैं कि वो अपना ध्यान नहीं रखती हैं. हो जाएगा लाइक वो प्रोसेस होता
Yeah, they
है
ignore.
ना?
They
वुमेन्स
ignore.
के
So
टेक टेक
ignore
केयर ऑफ फैमिली
health
है ना?
care.
दे इग्नोर.
Right. Okay.
हाँ,
It's okay.
हाँ, तो एक तो
So
बेसिक वुमेन्स हो जाती है.
ये जेंडर को ध्यान में रखते हुए, सो इन योर एक्सपीरियंस हाउ डू यू फील दैट सोसाइटल प्रेशर एंड द जेंडर नॉर्म्स affect the females health and the outcomes, and what can we do as a community, at a level of policy, for maintaining the well-being of the females?
The social norms that women used to face, especially like वुमेन्स ना क्या होता है घर में वुमेन्स को टाइम नहीं मिलता है ना? तो सोशल लाइक वुमेन्स को क्या काम दिया गया है? तो टेक केयर ऑफ योर हाउस होल्ड वर्क्स. एक सोशल नॉर्म ये साइड इफेक्ट है वुमेन्स के लिए कि आप अपना घर का ध्यान रखिए. ठीक है. एंड वही होता है कि वो भूल जाते हैं फिर अपने पेन को. तो फर्स्ट ऑफ ऑल आई यूज टू एडवाइज टू एवरी वुमेन प्लीज वो उस नॉर्म से प्लीज बाहर आइएगा. एक सोशल नॉर्म से क्योंकि लोग होते हैं कि घर में 10 लोग होते हैं फैमिलीज होती हैं. हो जाएगा ट्रीटमेंट हो जाएगा कोई बात नहीं कोई बात नहीं. तो सबसे पहले मेरा ये एडवाइस होता है कि वो सोशल नॉर्म से प्लीज आप बाहर आइए. जब तक आप एक वुमेन अपनी हेल्थ का ध्यान नहीं रखेगी तो हाउ कैन ही टेक केयर ऑफ द होल हाउस एनवायरमेंट. है ना?
Very true.
तो एक फीमेल के लाइफ में ये तो एक सबसे नेगेटिव पॉइंट है. एक घर का जो है ना घर का एक वुमेन को माना जाता है कि वो घर का काम करने के लिए होती है. तो वो भूल जाती हैं. आई थिंक मेरे साथ भी शायद माइट भी आया आल्सो सफर दैट कि नहीं वो आई थिंक आई इन्वॉल्व इन ऑल द हाउस होल्ड वर्क माय प्रोफेशन आल्सो. एक तो वुमेन्स आर आल्सो वर्किंग. एक डबल प्रेशर उनके ऊपर आ गया है. दे हैव टू टेक
Right.
केयर ऑफ हाउस होल्ड वर्क आल्सो एंड है ना? तो दे आर आई थिंक दे आर ओवरबर्डन इन दैट. दे हैव टू टेक केयर ऑफ अ प्रोफेशन आल्सो एंड देयर हाउस होल्ड. इस बीच में वो फंस गई हैं. तो
और
आई
फिर
थिंक दे
एक्चुअली
हैव टू थोड़ा.
हाउस चोर्स का एक्चुअली पूरा रोल प्ले करने के बाद भी आपको कोई क्रेडिट नहीं मिल रहा, ना वो ध्यान में आ रहा है कि
हाँ,
आपने वो काम
हाँ,
किया हुआ है
राइट.
एक्चुअली. सो
ध्यान में
दैट इज अनदर इशू.
बिल्कुल, बिल्कुल.
राइट.
तो लाइक थोड़ा-सा उस चीज़ से आई थिंक एटलीस्ट 10 मिनट्स यू हैव टू टेक इट आउट फ्रॉम योर डेली हाउसहोल्ड वर्क and your professional work also because you are all the only one who will take care of your
Yourself.
I
Yeah.
think family member and you're also to your
So,
so I think
yeah. So finally, you are actually very actively involved in the public health education. I've been through your bio, and we have been through your profile
okay.
also. You have been working rigorously. So can you tell us about the any initiative or current projects that you're working on to empower the females for the physical health or any kind of initiative, and how do you think that will impact in the long run?
The like the project that I am the basically that today's time I my personal aim that women should basically I pray for also fees after my कि जब मेरा at least 30 to 40 minutes to yourself for your better empowerment for your better development in the future में incoming and they are facing lots of problem in that case.
Very interesting and very awakening to know, and I guess everybody should know. Actually, we should have more sessions where these kind of talks are happening, so at least everybody's aware. So okay, so any
Yeah.
professional advice you would want to go to give to our audience and the females, especially because this episode majorly is for the females, I'm sure. So आप कुछ बोलना चाहेंगे उनसे advice
Right.
देना चाहेंगे तो please go ahead.
थ्रू मेडिकल टर्म में फ्यू एडवाइस हर एक वुमेन को देना चाहूंगी अबाउट दैट दे शुड टेक देयर विटामिन डी डेली. लाइक विटामिन डी का बहुत ध्यान रखें हर एक फीमेल बिकॉज सबसे ज्यादा साइड इफेक्ट्स आजकल हम देख रहे हैं कि विटामिन डी एक आई थिंक मोस्ट ऑफ द 90% आर वुमेन आर हैविंग लेस विटामिन डी इन देयर बॉडी एंड थ्रू दैट दे आर सफरिंग लॉट्स ऑफ प्रॉब्लम. तो इश्यूज जो उनकी बॉडीज में जो मैं आजकल के टाइम में देख रही हूँ वो आ रहे हैं. सप्लीमेंट्स प्लीज अपने आफ्टर बीइंग आई थिंक 30 प्लस दे टू स्टार्ट टेकिंग सम सप्लीमेंट्स जो मैं एक थोड़ा सा और ही एडवाइस देना चाहूंगी सेकेंडरी बिकॉज आई थिंक जो हमारा फूड इंटेक आजकल के टाइम में हो चुका है दे आर नॉट टेकिंग प्रॉपर केयर ऑफ दैट. तो थोड़ा सप्लीमेंट्स आप एक्स्ट्रा सप्लीमेंट्स प्लीज स्टार्ट कर दीजिए आफ्टर 30 यू कैन टेक स्टार्ट टेकिंग. And for the youngster, I'm saying please take care of your proper postures and your dietary habits that today आजकल के टाइम में बच्चे फेस कर रहे हैं because जो स्पेशली जो आजकल की जो यंग लड़कियां हैं जो फेस कर रही हैं, लाइक दे आर हैविंग अर्लियर, जो उनको जो पीरियड्स की प्रॉब्लम्स आ रही है अर्लियर स्टेज में, आई थिंक दे आर फेसिंग दिस प्रॉब्लम्स बिकॉज ऑफ द बैड डाइटरी हैबिट्स एंड और जो आफ्टर 40 इयर्स की वुमेन्स के लिए मैं स्पेशली एडवाइस करूंगी, प्लीज टेक केयर ऑफ योरसेल्फ, प्रॉपर स्ट्रेंथनिंग एक्सरसाइज उनको करनी चाहिए फॉर द बेटर मोबिलिटी ऑफ देयर बॉडी। तो ये 3-4 एडवाइस मैं स्पेशली हर एक वुमेन को देना चाहूंगी।
Okay. Okay, thank you so much. The audience, I'm sure
Yeah.
you're going to like the talk today and the advices she has been giving, because that's very important, very crucial part for somebody, because after a certain age, because now we are seeing early issues and health problems. So maybe in the future, you should actually take care of yourself, have regular exercise routine. If not exercise, have yoga routines and properly visit your physiotherapist. So in case, there's no point of having medicines. Always go to a
Yes.
physiotherapist, because that's
Yeah.
the best thing you could do for yourself. In the long run, you might benefit, and give
Yeah.
yourself
Always
time.
therapists are always, yes, yes, yes.
Please give yourself time, so at least you are fit. Everybody's healthy. Okay.
Yes. So basic basic advice
So
I used to
thank
give to all the women.
Yeah. So thank you so much for coming on the channel and finding out time. I know you have a very busy schedule. I'm glad that you could come to our channel and be with us.
Thank you, Dr. Arti.
And thank you for the insights. So and
It's really
Instagram.
nice to meet you here. Same here.
Yeah. Thank you, ma'am. Thank you so much.
Thank you so much. Thank you so much, Dr.
Thank you. Take care.
Thank you.
So this was Dr. Tanasvi Mattoo with us, and she has been talking about health. She has been talking about how females should take care of them at a certain point in time, like at a certain age. In fact, nowadays we are actually having early issues, and because of a lot of dietary issues, a lot of lifestyle problems people are having, the wrong lifestyles people are using for their lives. Everybody's adapting, and they're actually following both for the males and females. So physiotherapy is one such thing which can actually relieve you in the future. So in any kind of issues, any kind of active symptoms and problems, you should actually contact the doctor immediately, rather than actually being on the chronic or last stage, and go for regular checkups, so at least you recover fast and there's no problem in your body. In case it appears, for the early signs, you can still get an idea and pursue your doctor. So I hope you like the channel. I hope you like the talk today. I hope you have learned something from her as a female, in case anybody is watching. And I just wish that the family supports, as she has been talking about limited time for females to recover from their issues in the health, whatever they have faced, whatever they faced so far. So I just request everybody to support their females in the house, because it's not just easy to handle the home chores, but you're also it's a matter of the career that they're also handling at the same point in time. So maybe things might get tough for them, and sometimes we don't even acknowledge the home chores for the females, because it is actually a part of the social norms that we are facing nowadays. So I'm not saying everybody is doing that, but wherever it is happening, just try to uplift and provide awareness, so everybody's health is taken care of, and is the highest priority, and is at priority for the family, for their own selves, so the females can take care of themselves properly and stay healthy, stay fit. That's the motive. And so for more interesting talks and conversations, stay tuned, like, share, subscribe to the channel, and we'll see you the next week with another guest in the house. And the fascinating part is she's also a doctor. So stay tuned, like, share, subscribe, and I'll see you the next week. Same time, same place, same host. Thank you.